More than 400 million people are infected by this viral disease each year. What are the precautionary measures we should take and how we can stop dengue from spreading by making certain modifications in and around us? Let's understand more about it from Dr. Ashok Rattan. Thank you so much, Doctor, for joining us. We would first like to understand what exactly is dengue, this viral disease.
It's an acute febrile illness which normally is transmitted by the bite of a mosquito. So mosquitoes will come around monsoon. So whenever there is rain, and these mosquitoes are known as Aedes aegypti and Aedes albopictus. These breed in fresh water, and they can fly only till about 500 meters. That would mean that if there is fresh water collection around human habitation, then Aedes will be able to grow in that and they'll be able to transmit infection. They also bite during the daytime.
Doctor, how is common cold different from dengue?
Common cold is caused by various viruses and it is normally characterized by running nose and cough and fever. In case of dengue, after the mosquito has bitten and there's an incubation period of about 9 to 12 days, then there's acute febrile illness. And this fever lasts for about 3 to 4 days. Fever itself is not bad, but once the fever decreases, then there's chances of critical phase, where because of leakage of the capillaries or decrease in platelets, a person can have severe dengue. And once the person has passed through that stage, in another 3 or 4 days, then the recovery phase starts. Now, dengue virus is a virus which has 4 serotypes, and infection or recovery from one virus, one serotype, gives us protection for life against that serotype, but no protection against the other 3. In fact, there is association that if a person has had one dengue infection and suffers a second one, then the second one can be dangerous because the antibodies which are not neutralizing are formed and they sit on top of platelets. So when the new virus, a second virus comes, then the platelet gets damaged and that can lead to bleeding and death.
Doctor, how does it impact someone who is middle-aged?
Normally it is children and the elderly who suffer more. And that is why there's a lot of deaths in children when they have 2 attacks, when 2 different serotypes are circulating. And even newborns, if the mother has had infection and she's transmitted the antibodies to the child, then the newborn can also suffer from serious dengue.
Doctor, are there any tests that we can take to understand if we are symptomatic to dengue?
Yes, see, the virus, in the past they used to attempt to culture the virus, but then they also noticed that the virus, when the virus is there in the acute stage, during the fever stage, then there's an antigen known as NS1 antigen, which is equivalent to the virus. So if NS1 and there are either rapid test available or ELISA test available, which can look for NS1 fast, but otherwise PCR can be done, RT-PCR can be done. RT-PCRs are now available, which will not only detect dengue virus, but also give you the species, whether it is 1, 2, 3 or 4. So it will tell you whether you are now at risk or not.
So doctor, any message you would like to give to our audience on how to take precautionary measures and stay healthy and fit from this viral disease?
See, one is to prevent breeding grounds for Aedes aegypti mosquito. If there's collection of water in and around your household, you should remove the water so that during the monsoon season, there's no collection of fresh water. Second is that when you go out for a morning walk or evening walk, you should wear full sleeves attire so that the mosquitoes do not bite. There is no specific treatment for dengue, and diagnosis should be done as quickly as possible. But fever itself is not damaging. It is when the fever decreases by the third or fourth day, the critical phase starts, which is manifests itself by decrease in volume of blood. That means the blood gets thicker. That means packed cell volume increases, and there is symptoms of shock, or platelets decrease and there's chances of bleeding. So that is the critical period. Once those 3 or 4 days are overcome, then there's 100% recovery.